Global surveillance of catheter-associated urinary tract infections. Data collection helps in identifying the magnitude of problems and monitoring progress when applying solutions. Monitoring hospital-acquired infection rates is important in determining infection hotspots and the effectiveness of prevention and infection reduction techniques. The National Healthcare Safety Network, NHSN, is a U.S. hospital-acquired infection surveillance facility servicing over 25,000 medical facilities and created to monitor progress and ultimately eliminate HAIs. The National Healthcare Safety Network is part of the Center for Disease Control and Prevention. NHSN serves as a model for many national and international hospital-acquired infection surveillance systems. The International Nosocomial Infection Control Consortium, INICC, is an example of a hospital-acquired surveillance system based on the National Healthcare Safety Network. The INICC monitors hospital-acquired infection rates, microorganism profiles, and bacterial resistance in countries with limited surveillance and resources. Currently, the INICC serves more than 45 countries, using NHSN measurement techniques globally, reporting in English and recording data for many under-resourced countries which may not otherwise prioritize surveillance. However, monitoring infection rates in this way has limitations. The results are not representative of the entire country due to local and regional differences. Member hospitals must provide their own laboratory test results rather than an external impartial laboratory, and not all countries have chosen to participate. INICC and NHSN are not the only surveillance systems. Other countries and regions also sponsor surveillance systems. Other examples of HAI surveillance systems are sponsored by high-income, high-resource countries. Some examples are shown here, such as Japan Nosocomial Infection Surveillance, a part of Japan's Ministry of Health, Labor, and Welfare. Taiwan, Korea, the European Union, Hungary, and Germany also have their own surveillance systems. The uneven distribution of surveillance systems is evident in these examples and in the screenshot of the catheter-associated urinary tract infection rate interactive map available in the comments. The interactive map shows where a record of catheter-associated urinary tract infection rate data can be found. While this data is not an exhaustive collection, the African continent has very little evidence of surveillance. The table to the right summarizes the global data collected. The countries are listed from the smallest CAUTI rate to the largest. Germany has the lowest rate of CAUTI at 0.68 infections per 1,000 device days, while Argentina is the highest at 18.5 infections per 1,000 device days. The first author and date of the reference where the data was found is listed in parentheses. Hospital-acquired infection surveillance is important in determining infection hotspots and the effectiveness of prevention and infection reduction techniques. More resources are needed to increase surveillance in under-resourced regions.